Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Hello and welcome to another episode of Business Innovators Radio. I am your host, Ralph Brogdon, and joining me today is Tonya Juge. She is the founder of Tonic Physical Therapy. She is a certified functional manual therapist with a master's degree in physical therapy. She's licensed by the state of New York, and she is a member of the American Physical Therapy Association. She's the founder of Tonic Physical Therapy, and her goal is to be a conduit of healing for her patients and to educate the public in distinguishing good physical therapy as a compelling and powerful option for health and wellness. Very important. So, Tonya, welcome to Business Innovators Radio.
Thank you for having me. I'm excited to be here.
I look forward to digging into your business and your journey. Before we do, though, tell us a little bit more about who you are and the types of people that you help.
Okay. I'm a physical therapist who's passionate about offering a nuanced concierge model of care for busy Manhattanites who want to live well in their bodies. I had always been really into exercise when I was younger and had been diagnosed with back problems. And with the help of some professionals who thought outside of the box, I was able to return to health using biomechanical principles and exercise. My patients vary from teenagers to older, business people who want to be healthier, who a lot of them have been diagnosed with some sort of a back problem, or they're having some sort of difficulty and they're just functioning through their everyday life. And they come to me to either avoid surgery or to just for their body to move more efficiently and work better.
So is physical therapy only for people who have had damage to their bodies, or are there other applications of physical therapy besides accidents and injuries?
Absolutely. There are other applications. People have generally known it to be for someone who's injured, but therapists are also qualified to treat patients for wellness. And wellness includes just looking at the body and looking at all the joint movements and the muscle strength and assessing what's happening and offering certain types of treatment from myofascial release to very specific corrective exercise to help any body work better, to help people run faster, play tennis better, get through their daily lives with more ease.
Now, I, like a lot of information and knowledge workers, spend a lot of my time and most of my time sitting at a desk behind a computer. What should I be thinking about as I'm sitting here? What am I doing to my body, and how can I take better care of it? Considering I'm not a manual laborer. I don't get out and exercise in the course of my day unless I actually plan it. So am I going to have to do some special things here to keep my body where it needs to be?
Even more so, because of the sedentary nature that a lot of us live. There are many things that you can do. The sitting itself is an opportunity for healing or an opportunity to cause injury. So just the way you sit all day long loads your joints in a certain way, and some subtle changes in the height of your chair, the tilts of your seat pan, and the way that you're holding yourself all day can make a big difference in how your body ages. And if you're spending 8 hours a day think of the number of hours you're spending per week, per month, per year in that one position. So that one position has a lot of promise in it to help you if done properly.
I like that. So you're saying your body can be a blessing or it can be a burden depending on how you position it during a long workday.
Yeah, well, your body's always a blessing. It's what we do to it.
Mm-hmm. Good.
That makes it become a burden, or yes.
So your career in physical therapy, you started out at an early age where you got some bad news, and you hit on that a little bit in the introduction. But tell us more about your experience and how that motivated you to go down this career path of physical therapy.
Well, I had always, even prior to the experience, I had always been really into exercise and sort of studying the body just for fun. So the experience was definitely one thing that added to the puzzle of me becoming a physical therapist. But as a patient and as someone who had to go through the medical process, I'm very familiar with how important it is to have someone listen to your history and your injury, and to have someone look at you as an individual. And it was when I found someone who finally did that I found an alternative way to help myself. So I think it's something that I carry with me today, is that patient consciousness, and with the way that I approach my sessions, with the thoughtfulness that is put into each session with a client. And I'm always asking whether I can make the treatment a bit more for the patient, and a more specific and more tailored for what each body needs.
So it's really like a custom, what you do is like a custom health, fitness, recovery, and wellness package all in one, right?
It is. Sometimes people have they have a specific diagnosis and a prescription. So there are very specific things that you do for certain diagnoses that you don't do for other diagnoses. And that's what's really great about a physical therapist, because they have the medical knowledge to understand what your doctor is telling you. But at the same time, we can apply that to your body. We can look at your body individually and determine what it needs. I started my business because I wanted to develop a model of care that really gave attention to the individual patient. And I see clients for 60 minutes one-on-one. Because of that time, I'm able to actually give each person the attention they need, and I'm able to really connect their history with where they want to progress to, and the activities that are going to make a difference in their life.
Now, you work with a lot of people, and you're up close and personal with them. And you probably spend more time with them than their doctor does. To be quite honest, if you're there with them for an hour and you're seeing them probably once a week or at least a few times a month, what is the most common problem that you see when you're helping the people that you help? Can you give us some examples of problems that you see that keep coming up and how you solve them?
Sure. You're correct in that there is a lot of time spent with the client. We are usually seeing clients twice a week for 6 to 8 weeks. So it gives it gives us a chance to really hear things and see things that someone else is not able to see in a 10-minute period of time. It allows us to put the puzzle together. Some of the diagnoses that I see are back injuries, people with herniated discs or stenosis, knee injuries, any or problems, any kind of patella problem or ACL. But it really runs the whole gamut. I've been trained to treat the entire body. So some of the things that I do to help them is what you wanted to know.
Yeah, I mean, I'm just curious if there's anything that our listeners, because I think probably people, I think that people believe, I could be wrong, but I think most people think that, well, the only time I go to a physical therapist is if I have an accident or an injury. And your holistic approach to everything kind of educates me differently now that, there's other applications here besides just accident and injury. But there's probably people listening who would not necessarily think to go to a physical therapist for their back problem. And I'm just curious if there's anything that they could start doing right now to begin to see, for example, in their back, to begin to see some immediate improvement in their back. I think most people walk around, or a lot of people walk around with chronic back pain. Is there something they can do sitting at home that would be beneficial to them?
Absolutely. The first thing, we live in this very push society, push through the pain type of society. And the first thing that they can do, is just stop and listen to their body. This idea of pushing through pain or pushing through faulty movement patterns just to get the job done is one of the things that really stop us from progressing. Just listening to their body and noticing what positions they feel at ease in and what positions are not so comfortable for them, and avoiding some of those positions temporarily until they're able to start moving. Now, it really is hard to replace what a qualified professional can do, because a good physical therapist will actually has a dynamic understanding of anatomy and the way that you move in your body, as well as medical diagnoses. So they can watch you move, they can assess your body, they can pick very specific exercises that will help to balance your body. And it's really challenging to always get that view unless you have someone actually showing you what to do.
That's really good. And what you said is so true. And I'm going to get my wife to listen to this episode, because what you say is so true. She has had 2 back surgeries. She had 2 back surgeries before she was 40. And so her threshold for pain, her pain tolerance is really off the chart and what she can handle. But her philosophy and approach in life is, I can't lay around if I'm in pain. I have to push through the pain. And what I tried to tell her is what you said. Listen to your body. If your body is saying this hurts, you don't push through it. You listen to your body, rest and relax, and take things easy. But that's hard for me to convey to her. But is that about right? Is that what you're saying?
Pretty much. It's always the balance that we want. When you go to extremes, like some people just decide not to move at all, and that becomes an issue. And then some people just push through, and neither one is the answer. The answer is to find the middle ground, and you want to keep moving, but you don't want to do things that push you into pain too much. And you want to move, you want to sit smart and stand smart and exercise smart. Yeah.
that is so important, and it's so true. I think society and especially business people, entrepreneurs, people that are listening, they don't even have time to go to the doctor, and unless something has knocked them to the ground, they tend to push, doing it. They've always got something else going on, and so their health suffers. And that's why I like to have different health experts on the show, because I'm trying to communicate to business owners, entrepreneurs, coaches, consultants, whatever your business is. You've got to take care of your body. If you don't take care of your body, you won't be able to take care of your business.
I couldn't agree more. It affects your concentration levels. It affects, often my clients tell me that after they get out of pain and after they're just functioning well again, that they didn't actually realize how much it was interfering with their attitude at work and their concentration level, their ability to sit and do their work at the computer. I couldn't agree more.
Now, how would someone working with a professional like you really greatly improve not only their chances for success, but improve the odds that they're going to find that balance in between their physical health, their mental acuity, wellness? How can you help do things with them that they can't do on their own?
Well, I can look at the position of relationships among the segments of the soft tissues, of the symmetries, the proportions. I observe their breathing pattern. I use skilled manual therapy to manipulate fascia and mobilize joints. It's been my experience that a lot of people have gotten treatments that address like one part of the issue, or maybe on their own, even naturally, they address one part of the issue and it helps for a little while. But the body has to be freed. The motions and the restrictions and the excursion of the tissue has to be freed. And then after that movement is restored, the strength has to be re-engaged, and then it has to be made automatic. It has to be practiced, and we have to create a motor, what's called a motor pattern for those movements. And when you address all three of those aspects of treatment, you get really good results. I'd also like to mention the emotional part, because there usually is some sort of an emotional tie to some of these restrictions that are in our body. People hold things in their body, especially if they're not releasing it or, openly speaking about it. And so I usually recommend that clients are also addressing that with a professional or on some level as well.
Excellent. I'm speaking with Tonya Juge. She is the founder of Tonic Physical Therapy. She's a certified functional manual therapist with a master's degree in physical therapy. Tonya, tell me about Tonic Physical Therapy. How did that name come about?
Oh, Tonic. Tonic is the name of the deep muscles that help support you all day, the muscles that you don't even know about, the ones that you don't usually train at the gym. But they're the ones that are responsible for holding up your posture 15 hours a day when you're not even thinking about it. So my treatment, the focus of my treatment is on getting those deeper muscles to hold you properly just from achieving a balanced posture. And so I decided to name my business after that, since it is primary to the treatments that I give. I also developed this business model of seeing clients in their homes or offices 60 minutes a day, so that it would be easier for them to heal and easier for them to have treatment. And because of that, I'm able to give a maximum thought process for each patient's treatment session. I see only about 5 to 7 appointments per day, when the normal now is 20 to 30. But because of that model, it enables better results.
I can imagine. And you were doing something that most doctors don't do, and that is, you make house calls. And that makes total sense because if they are in an injury or in a recovery situation, it might not be the easiest thing in the world for them to get in the car and get in the taxi or whatever and go someplace. You come to them.
I do. And it's also much easier for them if they have a very busy schedule, as a lot of people in Manhattan do. It's much easier it saves them about 3 to 6 hours a week if they're having physical therapy twice a week for me to come to them. Absolutely.
Excellent. So you've got the tools, you definitely have the knowledge to help people recover and become stronger and pain-free. But on your website, you say that maintaining a life of optimized, pain-free movement is a lifelong process. I think a lot of people in the medical industry, they're kind of reacting to things. You're saying pain-free movement is a lifelong process. Tell us about that philosophy.
It's more like efficient movement is a lifelong process. We all have tendencies. We all have tendencies because of the way we sit all day or because of our genetic history or our injury history. And so when someone is educated on the specific movement patterns that will be helpful for them to correct, or the specific exercises that will keep their body tuned up on a regular basis, it makes a difference in their entire life, in the progression of their body through their life.
And I would imagine also, correct me if I'm wrong, but I would think be getting your movement and your posture and everything, that also helps with your weight. And on the other hand, weight problems can also contribute to physical movement problems. Is that correct?
That's definitely one piece of the puzzle. But I've had many people who were very fit who had just as many issues as people who were actually overweight. The general health of your body is very much affected, and of your organs, by the weight and, by everything that you put in it. But when you're speaking of strictly just movement mechanics and efficiency, there are some other things that come into play. It's, core muscles, dynamic core structure, mobility and excursion of tissues to move properly, and habits, very much your habits of how you position your body all day long.
Very good. So I'm just curious, are you working on anything right now that's got you really excited that you'd like to share with our listeners?
Actually, this podcast has me really excited.
Well, cool. Glad I could be a part of it. It's one of my lifelong, my long-standing goals is to teach the public about the healing nature of their bodies and to promote the profession of physical therapy, because I don't know that a lot of people really understand what we do or the history of our education. And I'm in the process of just putting myself out there with more social media, and I'm hoping to release some regular blogs soon that help to educate the public on their bodies and how to keep them in good health. Excellent. Well, I think you're a fantastic spokesperson. I know I've learned a lot, and the only downside to me is I'd have to go to New York City in order to avail myself of your services. But if someone is listening and they want to get in touch with you to find out more about what you have to offer and the different resources that you have, what's the best way for listeners to reach you?
You can go to my Facebook page, which is Tonic Physical Therapy, or you can email me at Tonya, Tonya, at tonicpt, Tonic.com, Tonya at tonicpt.com.
That's super. So this has been really educational. Do you have any final thoughts or words of wisdom that you'd like to share with our listeners as we close?
I do. Just one quote that my grandmother used to say, and apparently also the ancient Roman poet Virgil said this as well.
Yeah.
The greatest wealth is health.
The greatest wealth is health. That makes total sense. And I've looked at it. If you have all the wealth, but you don't have the health, then you can't enjoy the wealth, right?
Absolutely.
Well, this has been really, really good. Tonya is the founder of Tonic Physical Therapy in New York City, and she is a certified functional manual therapist with a master's degree in physical therapy. She's also a member of the American Physical Therapy Association. Tonya, this has really been enlightening, and thank you so much for your time today on Business Innovators Radio.
Thank you. It's been great being on.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.